Hello everyone, welcome to series 3 of outdated periodontal terminologies. Today I'm going to talk about a condition called as acute necrotizing ulcerative gingivitis. Okay, so the term acute has been removed in 2017 classification. Now you are going to call those diseases as necrotizing ulcerative gingivitis. Why? Because see, for a disease to be acute, it should be rapid onset, faster healing. Okay, what they found out is some cases of these necrotizing ulcerative gingivitis patients, they have chronic or recurrent episodes and they exhibit slow healing. Okay, so what they did was they removed the term acute and they broadly classified these diseases based on the severity. Say for example, if this much amount of tissue is involved, I'm going to call this as this disease. Okay, so based on the severity, they have grouped these necrotizing diseases as necrotizing gingivitis, necrotizing ulcerative periodontitis, necrotizing stomatitis, or NOMA. So if you take a look at necrotizing gingivitis, I'm just zooming it out for you. Necrotizing gingivitis means there's going to be necrosis of the marginal gingiva and the interdental papilla. There's going to be complete necrosis of the epithelium and some superficial necrosis of the connective tissue. There's not going to be involvement of the attachment apparatus. Okay, as you can see here. So this situation is completely reversible if treated early with the treatment probably will be debridement followed by antibiotics. If treated early, then it starts healing by 24 to 48 hours and complete healing takes place around 7 to 10 days. It is completely reversible. So if a patient is maintaining poor oral hygiene or is immunocompromised or a patient is having more amount of stress, those will come under the primary etiological factors for necrotizing ulcerative gingivitis. And the predominant organisms, what you're going to see is fusospirochetal complexes. Okay, so if a patient is not treated early, if the patient is not treated in this situation and the patient moves to this situation where there is going to be necrosis of the connective tissue, or in simple terms attachment apparatus, then I'm going to call these patients as necrotizing ulcerative periodontitis. Okay, as the name implies, there is there is going to be clinical attachment loss, there is going to be bone loss, and one of the key features in necrotizing ulcerative periodontitis is there is not going to be any pocket, any true pocket as such. Why? It's very simple, because the tissue is getting necrosed. You do not have sufficient amount of time to probe the area because it is already getting necrosed. So the tissue is dying, tissue is necrosing. So you do not find time, or you cannot see a true pocket in these patients as the tissue is getting necrosed. Okay, so if the patient is having necrotizing ulcerative periodontitis and still resist to get treatment, then it again progresses to what is called as necrotizing stomatitis. So what happens? It crosses the mucogingival junction, it involves the adjacent structures. And the last severe situation is NOMA. Okay, these patients, they have gangrenous infections which involve the entire face. So these two situations, that is necrotizing periodontitis and necrotizing stomatitis, they are reversible but not to complete extent. Okay, but if you take a look at NOMA, it is completely reversible. Okay, so these diseases, they mainly require prompt treatment and removal of the etiological factors. Okay, so I hope this video makes sense. Thank you so much for watching the video. Have a great day. Thank you.